This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Thanks for joining us on WAJR. I'm Kyle Wiggs, and with us Dr. Brian Huggins, Health Officer for Mon County Health Department. His monthly visit with us here on WAJR. Good morning.
Good morning. Happy Monday, Kyle.
Thanks for coming in. All right. Well, we've got a little bit of winter. It's going to warm up a bit this week, but winter comes back this weekend. I know it's cold this morning, but with spring on the horizon, people are thinking travel.
This is that big time of year, especially if you're thinking about going internationally, that people have probably already even maybe booked their tickets because you got to book those tickets a few extra months out to get the better prices. And there's just a lot people don't think about. It doesn't matter if you travel in the U.S. or you travel internationally. There's things about your health that you probably should consider.
Yeah, absolutely. And check that passport, too, because passports now expire, right? They have a 10-year length. I don't think that was the case before, but now they expire after 10 years.
Yeah, and a lot of that is, of course, they want to get an updated photo. Yeah.
That makes sense. Okay, so a lot of information that you need to kind of get together and gather and have at your disposal before you go. Despite the in addition to the passport, you need some health information.
You do. Whenever you're getting ready to travel, you need to really think about, and let's talk a little bit about in the United States versus outside the United States. So obviously in the United States, you're going to have access to a lot of things that you don't have overseas. You're going to have access to pharmacies. You're going to have access to the drugs that you're used to getting. You're going to have, access to your health insurance in a way that may not be the same overseas. So before you travel, make sure that you write down, if you're someone that has chronic diseases, it's probably a good idea to either have written down or have on a piece of paper, what are your conditions? What are the medications that you take? Especially if you're traveling alone. That way, if somebody finds you unconscious for some reason, they kind of know what's going on with you.
Yeah. Okay. So if you take a lot of medications, obviously you need to be well equipped before you leave. But what happens when you get to your destination, you get your bag stolen or you lose it, and there goes your medicine. Now what? Right.
And again, in the United States, it's not so bad. You can usually reach out to your provider. They can write you for an emergency prescription. And insurance companies tend to be a little iffy when they're like, oh, you just got a refill, or not going to give you that if the provider is sure to put temporary refill. And there is a chance insurance will still not cover it. So you've just got to be prepared. You may have to pay out of pocket somewhat for some of those scripts. There is plans like GoodRx. It's a free card you can get that'll help bring the cost down. Internationally, that's a big difference. Internationally, they may not even have the meds. Some of the meds you take might even be illegal. So if you take, say, ADHD medication, some of those medications are considered illegal in Japan. You can't even get through customs with those medications. So it is important to look, especially if you're on a controlled substance or even some depression medications, that you look ahead and actually see in that country, is there any restriction to being able to bring those into the country? And one of the questions I get a lot is, do the medications need to be in the original bottles if I'm going to go through customs? And the answer to that is a best practice. If it's in the original bottle, what can also happen is if you go to your pharmacy, they can actually take a printout and make you a printout of, this is the medication you take, a picture of the pill, and you'd actually have that to be able to go with. And that's especially helpful if you decide to do the Monday, Tuesday, Wednesday, Thursday, Friday, the 7-day pill thing, right? I've never heard of somebody getting stopped doing that. But if the pharmacy prints that out for you, and what I'll also recommend to people is, if you don't want the pharmacy to do it, take a picture of the pill next to the bottle, and you can show people, look, this is what that pill is.
Never even thought of that. The fact that a legal medication that's prescribed by a doctor, that you have a prescription for, you have in a bottle that indicates the prescription, could be illegal to take into another country.
Yes. And that just goes in line with just some of those differences in medicine across the world. I mean, health insurance is another thing. Here, obviously you're covered in the U.S. Before you travel outside the country, I don't care if it's Canada or even Mexico, make sure your health insurance covers you. I always tell people, just be prepared to potentially pay cash. If you're in a developing nation, especially, care is actually not going to be that expensive. I was military. I was assigned overseas in Germany for 3 years, and we had people that would sometimes have to go to the ER when they were, say, in Turkey, and they would walk away from the ER with like a $25 bill. So big difference in cost. Right, yeah. So at that point, they're like, do I even really want to get reimbursed? Because they're expecting, in our country,
Hundreds,
it's $3,000 to go to the ER. So, but check with your insurance company, see where they cover.
Okay. In terms of where you're traveling to, that makes a lot of difference in terms of the disease risk, right?
It does. And a lot of people, we forget that even in the United States, that we have some infectious and communicable diseases that you can get when you're out and about. And other people coming to the United States would be getting this same talk. So the service, one of the services we offer at the health department is if you're traveling, you can come see us. There is a fee, but you can come see us and we can walk you through and give you a little printout of all the things that you could possibly come into contact with. And the closer you get to the equator, the more diseases there are, the more venomous animals there are. So it's, things like warmth. We like warmth, right? I mean, how many people are moving to Florida and Texas? So, yeah, so it's no different for other animals and for diseases. But once you get into those other mosquitoes, it's especially because of mosquitoes and ticks and things like that.
Okay.
Yeah.
All right. So, again, what do you do to prepare? You just kind of know the risks?
So, yes, the most important thing is to actually know the risk. And there are some general overall tips that are just good practice. Okay. So one of them is going to be when you're traveling, especially, so let's talk about the United States. Let's just talk about that for a second. Water. Water is a big thing both outside the country and inside the country. In the United States, every place is going to have clean drinking water coming out of the tap. Outside the United States, not necessarily.
So much, yeah.
Right. And there's a lot of countries that you probably just need to do bottled water. And the biggest thing that people forget about is brushing their teeth. People will drink bottled water whenever they need to drink a water, and then they go to brush their teeth and they just rinse their toothbrush straight in the sink. Boom. You can get diarrheal disease. So it's actually something that you want to think about. Showering is fine as long as you're not somebody that opens your mouth in the shower, singing in the shower, just letting the water run in. Probably not a good idea. In the United States, we have things that live in the water, like something called Giardia. Giardia is a little, it's a parasite basically that lives in the water, and it's in freshwater streams. And if you go kayaking, if you are swimming in that water and you drink some of it, it's possible even in the United States, you're going to get some of these diseases, diarrheal diseases. Like if you go camping and you start having a lot of diarrhea, probably want to see a doctor.
Yeah, you've got something, most likely. Okay, what about cruise ships? There's a lot of, again, there's a little bit of risk there in terms of things that spread like wildfire on a cruise ship.
Yep. And, people, you're in a contained system. And I will say that after COVID, the air circulation on cruise ships has improved, and they've put in better filters. Prior to that, you're pretty much in a dorm setting. And anybody that stayed not in a luxury cabin realizes the little tiny places that they kind of shove you down inside the ship. And you're eating with everybody at tables, you're talking. One of the biggest things that spreads is norovirus. And for those people that don't know, norovirus is the leading cause of gastroenteritis. Gastroenteritis is GI infection, so diarrhea, vomiting. So norovirus is a big problem, and on a cruise ship, it spreads rapidly. It is actually, it's kind of gross, but it spreads either through fecal or vomit material. And what people don't remember is that, well, nobody vomited on me, but people get regurg. So if you've ever had that moment where you ate too much or you've got acid reflux, you get it in your mouth and then you cough, you have now spread that to your entire table, and that's how quickly and easily. And daycares. So this is another big thing that spreads through daycares. Anybody that's got their kids in daycares has probably experienced a neuro outbreak at some point.
Okay, so things to do to stay safe on a cruise ship.
So biggest thing is wash your hands, especially before you touch anything food-wise. Try to avoid people that are coughing and sick. A little hard to do. One of the other big things is shore excursions. So a lot of people think, oh, I'm going on a cruise, I'm safe. Well, if you're going to do a bunch of shore excursions, you need to now think about, well, what is on the land? A lot of people, we used to Caribbean cruises were the big thing, Alaska cruises, but now there's a lot of South American cruises. There's people going on Asian cruises. And anytime you step foot on the land, you have to really start to now look at the map and determine what your risks are. Cruise companies are pretty good at giving you a good background on that, but it never hurts to come in and talk to somebody.
Okay. And again, you can do that at the Mon County Health Department. Last thing, the plane.
Yeah. So traveling on planes, you got to be wearing a mask is not necessarily a bad thing. The way that planes circulate the air, you should not, if somebody in the back of the plane is sick and you're in the front of the plane, in reality, the air circulation should prevent a huge amount of disease spread. The exception to that would be something like measles or more infectious disease. However, you are stuck in an airplane with a bunch of people. So you should consider wearing, if you really want to be safe, wearing a mask on an airplane will help you prevent you from getting diseases that are circulating around. If you are sick flying on an airplane, it really is a common courtesy to do that for other people because you are very likely going to infect at least the people in the seats next to you.
Yeah.
Another big thing about flying, and this is traveling in general, is pregnancy. So a lot of people don't think about when you're pregnant that there are restrictions on the airlines as to when you are allowed to fly. A lot of them won't let you fly after 36 weeks. Now, how are they going to know that? Realistically, they're probably going to ask you how pregnant you are. Yeah, I mean, there is some level of honesty there. They're not going to ask you for a note. A lot of times, though, some airlines, depending on the airline, will actually want a note from a provider saying they have cleared you to fly after, say, 28 weeks. So it is important to think about that as well because of the altitude. And if there was a cabin pressure release, heaven forbid, that would be a situation where the baby could be at risk. And so that's something that you want to think about as well.
Interesting. Here's the thing about a mask. And I don't travel a lot. I travel maybe fewer than 10 times a year on a plane, between 6 and 10 times a year. I wear a mask. And one of the reasons why is because it keeps me from putting my fingers near my mouth. And and it seems to me they're doing a better job of cleaning the plane between flights. There's the flight attendants wipe things down. They wipe down the back of the seats. They try to wipe down the chairs or the trays. But if they don't, and you've sit down next to after someone whose child has had whatever all over the place, you're going to get that on your hands. It's going to get in if you put your hands near your mouth or your eyes, you're going to get whatever that is. So that's one of the biggest reasons. I still wear a mask on planes. That's one of the biggest reasons why it keeps me from getting my hands near my mouth.
Yeah, and the big thing people forget about, and this is good for traveling too, is when you leave a bathroom.
The laboratory, that's another thing.
Yeah. Usually in the United States in particular, we wash our hands before you open the door to leave the bathroom. And anyone that's sat in the bathroom long enough has watched people that don't wash their hands at all and leave the bathroom. If you've just clean washed your hands and someone before you didn't, and they've touched that handle of the bathroom, you've now got fecal material potentially on your hands. And that is how you can get. So when you're traveling over abroad, cholera, typhoid fever, hepatitis, there's all kinds of things. And to some extent, you can get that in the U.S. as well. So hand sanitizer. Keep a little bottle of hand sanitizer with you for trips like that.
I do all these things. I take hand sanitizer and a little pack of Clorox wipes with me when I'm on the plane.
Right. It really is a best practice.
And a mask.
Right. And I know that everybody has their different beliefs with that, but I'll tell you, when you do it, you get sick less.
Well, that's the thing. You get to where you're going, you're all excited, and the first thing you do is get sick.
Right, and especially because you're usually fatigued. So now you're on sleep deprivation, right? You've got to travel, especially if you go to California or overseas. And with that fatigue, your immune system, if you aren't getting good sleep, your immune system is going to be down. So now you're even at higher risk.
All right, we are with Dr. Brian Huggins, health officer for Mon County Health Department. We're kind of blasting right through this show here because we've got good information. Let's talk about adventure travel in terms of going to tropical locations. There's some things to think about.
Absolutely. So there's a lot of people that want to do some more adventurous kind of travel. And one of the things people don't think about is altitude sickness. So Machu Picchu is on a lot of people's lists. And I'm not talking about climbing a mountain like Mount Everest, because even Machu Picchu, once you get over about, say, 8,000 feet, you can start to get altitude sickness. And there are places around the world that is just where they live. And I get a lot of people that want to climb Kilimanjaro because it's the easy of the tallest mountains in the world. Yeah. Altitude sickness is a real thing. You can get very ill to the point that you can get brain edema. You can get pulmonary edema. There's things that, fluid on your brain that can kill you. There are medications that can help with that. And so by seeing someone that knows about this, you can actually get medications that will help. But the actual best way to do it is just acclimation. Trying not to scale too fast. That is the number one thing. People die every year going to places with high altitude, especially places like Kilimanjaro, because they think, I'm in shape, I'm good to go. They try to climb the mountain too fast, and that's when they get into trouble. So that's just one area of adventuring, that you're going to want to think about. Another thing that you should think about when you're doing adventure travel, a lot of people are like, I want to go be where the people are. I want to live with the locals, which is great, and I fully support that. However, you really got to think about your risk for food. So eating street food. Street food is probably one of the biggest reasons you're going to get traveler's diarrhea, or possibly something worse like typhoid fever or cholera. They just have different practices for how food is inspected in other countries. The other thing you have to think about is they might be washing the food. Even fresh fruit, people think, I'll just get an apple. What's the harm in getting an apple or an orange? Well, if they wash that food with unclean water, now it's on the surface of that. And you think, and you can't go just wash it in the sink either, because that won't necessarily keep it clean. So that is something that you have to think about. And then I always like to make a caution about bats. Bats in caves. Because I will get people all the time that are like, oh, we're going to go in a cave. And you see that even in the U.S. Bats carry rabies, and bat guano carries a lot of disease. So bat guano, bat poop. And so you definitely want to think about that for sure.
Okay. So if you're going, what do they call it? Spelunking? Spelunking.
Yeah.
If you're going spelunking in West Virginia or anywhere else, you have to worry about the bats. Okay. One more thing is just your personal safety as well, in terms of people out there looking to do bad things and take your stuff.
Yeah. Pickpocketing is a big thing around the world. Europe in particular, so that's probably one of the biggest risks that you have when you go to Europe is a pickpocket. And that's because they have made handguns illegal. So with handguns illegal, you get more petty theft. And it's usually kids too. It'll be just little kids. I was in Barcelona, and I actually got, I just wasn't paying attention. I always keep my wallet in my front pocket. Mm-hmm. So I'd being a guy, we have wallets, and I always keep my wallet in my front pocket. And this one time I didn't. And this kid came up and started kicking my leg like it's a soccer ball. And I'm like, what in the world? And then he just patted me on the back and walked away. I was like, wait a minute.
Yeah.
And I realized right then, and I actually chased him down and got my wallet back, which is not something that I would recommend people do. But I did. So that is something that you want to think about. Ladies, if you have a purse, always wear it cross-strap, like take it across your body. I've seen people on bikes that will just come up to chairs and grab things off the chairs and bike away. So just always have your stuff secured.
Okay. And backpack's a good way to do that as well, right? You just got to make sure that they're zipped up and they're secure, and even backpacks have locks on them, right?
Right. Yes. So backpacks, that's anything that you can secure around your body. And then there's belts you can put money in. I would not put money in your shoe. Everybody knows that trick. So, yeah. But speaking of shoes,
right,
just as another tip, scorpions. So if you are traveling, doing adventure traveling, remember that scorpions and spiders can crawl into your shoes, which is why you want to get them off the ground if you're camping in a place that has problems with that.
Okay, so keep the shoes off the ground. How big is I've never seen a scorpion.
Well, they have different sizes. But the funny thing is that the smaller the scorpion or the more medium size is probably the deadlier. The big ones, it's like tarantulas. Tarantulas actually aren't that harmful. And I recently learned a tarantula lives in about a 1 foot by 1 foot space, and they're happy with that. If they get more space in that, they start to look for mates. So people that actually have tarantulas will run into a problem where, if you buy a tarantula in the store and you give them too much space, they'll actually potentially walk themselves to death trying to find a mate. Yeah, I know. Yeah.
We could do a show on that maybe someday. All right, great information. We appreciate it. Again, if people are traveling, contact the health department. How?
Yep. So you just want to reach out to us, by phone or our website. Either way is great. It's 598-5100, 304-598-5100. And the last little thing I'm going to talk about is there are a bunch of vaccines. So the last thing I want to caution people on with international travel is it can get very expensive. And people realize that at the last minute. People going on mission trips, students that are traveling abroad, their insurance looks at travel vaccines as a luxury item, and they do not cover things like typhoid. They do not cover rabies. They do not cover cholera. So some of these vaccines can get pretty pricey. So it's really important to have that discussion in advance before you book your trip, just because, some of these diseases you can prevent with a vaccine, but once you add in the medications and the vaccines, you're starting to add up price.
All right. We're out of time. Thanks for the information. We appreciate it.
Have a great day.
That's Mon Health Talk on this Monday on WAJR.